trip, there were a number of times when my own values were actually put to the test, and I had to question my perceptions of animal welfare, particularly at times when human health and human living conditions were so poor. And I didn't really comprehend until I got there how closely the animal health and human health are linked, particularly in areas where there's such poor hygiene. Obviously, zoonotic disease is a really important part of this relationship, and I went to have a chat to a professor of parasitology at Nairobi University about it. So what particular zoonotic diseases are a threat to the community in general, not just the vets?
Well, bacterial diseases like anthrax, brucellosis, those are important. We also have diseases like the viral diseases, rabies. We also have parasitic diseases like echinococcosis, which is important in parts of northern Kenya. Yep. And we have tapeworm, Tinea sorium, and Tinea saginata, which is important in Tinea sorium is important in areas where pigs are kept outdoors. We also have Tinea sorium, which is actually common in various parts of the country, especially where meat is consumed without proper cooking.
So, I mean, we get the pork tapeworm in the UK as well, but what are the particular risk factors that you think may make it more common an occurrence in East Africa?
Yes, it's more common in East Africa because of, one, the possibility of keeping pigs outdoors and then exposing them to human feces, where the level of sanitary facilities are not so good, and the pigs are roaming. The level of hygiene is not so good, water is not available, so people are not able to wash their hands properly after using the latrine. So those factors make it more common in some of the poor countries or developing countries than, for example, in Europe.
Okay. And is this a disease that the communities know about? Do they know about tapeworm, and do they know about the risks?
In some of the communities, they actually think it's not a disease, because the disease also causes neurocysticercosis in humans. Yeah. Apart from the infection in the intestines of the adult parasite, you can get an infection in the brain or nervous system where the human beings actually develop epilepsy. So it's one of the causes of epilepsy. But in some of the communities, they actually think it's witchcraft. So we are trying to find out, do they know the association between the disease and the transmission and the pig, so that we can be able to tell them this is how you can break the life cycle.
So it's about sort of educating
There's a lot of
communities.
Improve sanitation, improve the education, so that people know exactly what is the problem and how does it come.
So there's an example of how animals can have an adverse effect on human health. But I chatted to Dr. Rogers, a vet at VetAid, about the HIV impact mitigation programme, and he describes how keeping livestock can make a real difference to quality of life. I know one of the things that you're doing here is actually giving chickens and goats to sort of victims of HIV. How does this part of the programme work?
Yeah, what I'm saying, this is the food security component. So we understand in Tanzania, we say over 90% of our people rely on agriculture to procure a living. And we know that poultry and small stock need little or less investment in order to start up as a starter kit. So with the poultry, we know poultry can multiply very fast if the people have been trained very well on husband of poultry, as well as small stock need very small areas in order to raise them. So the fact that these type of stock have high turnover, it reduces the level of poverty very, very, very fast, as well as supply a cash flow very fast to these communities, as well as the food. So that's why we started investing on poultry distribution as well as goat distribution.
So the next clip is me chatting to Lucia Meyer, who is an HIV sufferer, and she describes a little bit about how the programme helped her. Can you tell me what the HIV impact mitigation programme has done for you?
My situation was terrible. I didn't have any food to eat and I didn't want to get up or dressed in the mornings. But through this programme, I was able to get a goat and some chickens, and the goat has now had twins. So now I have food, I milk my goats every morning, and I drink milk and eat eggs and chicken.
So how has this actually changed your personal outlook, the help that you've received from this programme?
I can't even begin to tell you. I have come so far. Now people say to me, "You look very well and you are dressed nicely." They even say that I have beaten my disease.